Very good morning to all of you. It is with great pleasure that I announce today keynote speaker, Professor Stefano Bartolini. Stefano is professor of political economy and economic of happiness at the University of Siena. He's the author of many science essays, popular science essays and articles that have been published in prestigious journals. His manifesto, the Manifesto for Happiness, has already been translated in 5 languages and is being translated in English. I also would like to mention that Stefano has participated into many policy initiatives and political debates. Just to mention a few, he has collaborated with the OECD. He has been a member of the International Panel on Social Progress and of the World Wellbeing Panel. His research starts from the observation that the current economic and social order appears unsustainable along 3 dimensions: well-being, social capital, and environment. So the crucial question which is motivating his activities are, why does this happen? And most importantly, is it possible to reconcile economic prosperity with a better quality in environment, relationship, and well-being? I've had the occasion to listen to several of his inspirational talks, and I'm looking forward to this one. But before this, let me thank the FNR, the Luxembourg National Research Fund, who has generously supported this conference. And I would also like to especially thank the Caritas Luxembourg, who has supported this talk. Stefano, the floor is yours.
Thank you very much. Well, first of all, I'm so glad to be here again after the long COVID break. And I'm going to talk about the COVID break. And many thanks to the organizer for inviting me, however. I'll argue that the risk of epidemics has enormously increased over time and that we entered an era of high risk of epidemics. And this raises important questions. Is it possible to control epidemics with lower social, economic, and psychological costs than what happened for COVID-19, which has been a kind of disaster for Western societies? And if yes, how? What kind of changes are needed to make societies resilient to COVID? And do the economic, political, social, and cultural changes triggered by COVID-19 lead towards a society which is more or less resilient to epidemics? These are the questions. Increasing outbreaks of infection diseases. Here you see the impressive progression of epidemics across the past few decades. And this is a list of the most recent zoonoses episodes, which are increasing their pace and also their seriousness. And you see the animals from which they originated. Zoonosis is an infectious disease that jumps from animals to humans, which is probably what happened with COVID-19. There is still the hypothesis that of a lab accident, but however, zoonosis episodes have increased enormously. So there's a risk there. Why the risk of zoonosis has increased? First of all, loss of biodiversity. Viruses jump more and more often into humans because the animals that have always hosted them are exterminated by human invasion of their natural habitats. It's an invasion motivated by agricultural, mining, forestry, and urban expansion reasons. The more we enter into wild regions and accidentally come in contact with wild animals, the more the probability increases that a pathogen make the leap of species becoming pathogenic for humans. Then there's climate change, which in the face of rapid climate change, survival for many species depends on moving to track shifting climates. This will produce novel opportunities for viral sharing among previously geographically isolated species of wildlife. And viral sharing among animals increases the likelihood of viral sharing with humans. And then factory farming is probably the biggest risk factor. Enormous, industrial breeding. We created enormous concentrations of animals in which live in their short lives in desperate hygiene conditions in which they are constantly treated with antibacterial and antiviral drugs. This is a perfect recipe to create pathogens which are resistant to drugs. So, I'm sorry to say that epidemics, the high risk of epidemics will become part of what is called the new normal. And we have entered simply an age of high risk of epidemics. And the question is how to reduce their costs. Because it's a critical question, because COVID-19 imposed a heavy toll to Western societies, economic, social, psychological, and even in terms of lives. We did not perform well compared to other countries during the COVID crisis. Look at these are fatalities. And if you look at the list, you see that many Western countries have relatively high fatalities. This is during the first wave of COVID, but this data did not substantially change afterwards. We had more deaths than other countries. Why did this happen? Why so many people died? And why did we suffer so high social, psychological, and economic costs for the COVID crisis? Well, COVID-19 has highlighted some weaknesses of Western societies that have made them vulnerable to epidemics. This is why COVID hit so hard at us. These weaknesses are three. The main one, high inequality, many chronically ill people, and poor social capital. I'm going to talk about this. Too much inequality. This is an UK numbers from the UK. Basically, black people has a risk of dying from COVID-19, which is 4 times higher than white people, and all ethnic minorities has a higher risk than white people. The US show very similar data. And these are two very uneven societies. This is, of course, is strongly related to income inequality, which creates poverty, overcrowding, and residential segregation, worse hygiene conditions, less healthy lifestyles, and jobs that cannot be done from home. Look at how this chance is related to income differences. Lower incomes have lower chance to perform their work from home. And too many chronically ill people. COVID-19 disproportionately hit chronically ill people, but the problem is that Western countries have accumulated growing numbers of chronically ill patients. Look at this. The blue bar is the healthy life years in 2010, and the yellow bars is healthy life years in 2015. This is just an example from European countries, and it is for females. You can easily check that the blue bar in many cases is longer than the yellow bar, which means that healthy life years have shortened from between 2010 and 2015. And these data are very common in Europe. Well, everybody knows that longevity has been continually increasing, but in many countries, healthy life is shortening. The amplifying difference between life and healthy life means that a growing share of the population is chronically ill. We have created an army of chronically ill people, and that's where COVID-19 hits. And then the third weakness of Western societies, poor social capital. You see here an image of people fighting for toilet paper. In a paper written by Francesco Saracino, Julian Slater, and me, and I, we analyzed the role of trust in other people and in institutions during the COVID-19 crisis. And we found that less trusting countries in the first wave of the pandemic adopted more stringent government policies, were less effective in controlling the spread of the contagion, and were less effective in reducing mortality. I'll get into this paper. There are two possible governmental reactions to epidemics. One is centralized control, and the other is citizens' involvement. The paradigm of centralized control is China, of course. The Chinese government reacted to the COVID-19 epidemic by invading the privacy of its citizens, monitoring their smartphones, using hundreds of millions of cameras for facial recognition and body temperature measurement, forcing people to monitor and report their medical conditions, and employing drones to enforce shelter-in-place orders. In this way, Chinese authorities quickly managed to control the epidemic by identifying infected individuals, tracking their movements and contacts, and enforcing rules. And the paradigm of the alternative is especially the citizens' involvement, is especially South Korea and also Taiwan. This model relies on people's responsibility and civic behavior in these countries. Swell positives complied with shelter-in-place measures, and people cooperated in mass testing, tracing, and social distancing, for the most part voluntarily. Just an example, in one day on April 9, 2020, nearly 500,000 of South Koreans were tested for coronavirus, a level of participation that would be impossible to impose on a recalcitrant citizenry. These countries avoided in this way extreme personal mobility restrictions and closure of airports. This strategy has also been a success, with low mortality and economic costs, much lower than in the West. European countries too implemented a wide range of containment strategies. For instance, during the first wave of the epidemics, many Southern European countries introduced stringent lockdowns compared to Northern Europe, which adopted milder policies. No country exclusively relied on enforcement of voluntary cooperation. Actually, governments adopted a mix of the two extremes. However, what matters is on which side of the two extremes this mix hangs, because this heavily affects the psychological and economic costs of an epidemic. Such costs increase with the severity and length of the containment policies of lockdown. The estimated global cost of the pandemic during the first wave of COVID-19 is astonishing, between 8 and 16 trillion dollars. As for mental health, it is well documented that the post-traumatic stress, depression, anxiety, insomnia, confusion, anger, and stress soared during lockdown and quarantine. That's why the mix chosen by government matters. Centralized control exerts a heavier toll on society because it relies on long and severe restrictions of economic and social activity. European countries adopted different policies with different levels of stringency of containment measures. Here you have an image taken from an index of the government response stringency. And the question is, what makes a country choose centralized, the mix of centralized control and voluntary cooperation of citizens? Well, for Asia, the answer is easy. It's the nature of political institution. China is an autocracy, and of course, it was highly tempted to reinforce their centralized controls on their citizens. And South Korea and Taiwan are democracies, so it is easy to explain why. But what about Europe, where all governments are democratically elected? What makes those differences? Well, our hypothesis is that it is trust in other people and trust in institutions. Europe is an ideal sample for this test because political, economic, and socio-cultural differences can affect governments' choices in ways that is difficult to control for. So what we need is a sample of countries, of reasonably similar countries, with large differences in trust, in their level of trust. That's Europe. Why do we think that trust was important? Because limiting contacts without limiting freedom requires citizens' cooperation. And trust in others is a fundamental indicator of the ability of a population to cooperate. And governments in countries where trust in others is low may have little confidence in citizens' cooperation. This would lead them to prefer coercive measures. And why trust in institutions? Because trust in institutions is recognized as an important determinant of citizen compliance with public health policies. In countries where trust in institutions is low, governments expect low citizens' compliance. This makes them lean towards coercive measures. This is one example of our results. The index, we built an index of trust in others and trust in institutions, and it is negatively related to the government response stringency index. Here, these relationships, the relationship of the government stringency is shown only with one component of our index, which is high confidence in government, and it's still a negative correlation. This is the distribution among countries of our index of confidence, and these are the results of our regressions. We regress the government response stringency on our index of confidence. The coefficient is negative and significant, indicating that the higher trust, the more trusting is a country, and the less stringent are the measures to contain COVID-19 it took. Just a mention on the controls. We control for GDP per capita because it proxies the possibility, economic resources that a country can mobilize against COVID, better testing, better enforcing of rules, and the Gini index, because as we have seen, high inequality creates vulnerable population groups, which may drive the government towards more stringent measures. And the total deaths before the lockdown measure the seriousness of the emergency that countries faced. And the total number of beds in intensive care units is justified by the fact that many governments justified their lockdowns with the need to avoid a collapse in their healthcare system. So it measures the capacity of the healthcare system to face the COVID pandemic. The average number of life years with chronic disease, we have already seen that it's an important variable. And share of people that rarely meet others, that's just because the more people have face-to-face contacts and the more the epidemic is supposed to spread. And we also regress the speed of decline of contagions on a similar set of variables. And again, trust, the coefficient is significant, indicating the higher speed of decrease of contagions, the higher it is trust in country. And also mortality was lower in more trusting countries. Well, this is a bivariate relationship. My first conclusion is this. Societies where trust is highest face the epidemics with lower economic, social, and psychological costs faster and with less deaths. So trust is a very important component of one country's resilience to COVID. Economic, social, and psychological costs of an epidemic critically hinge on the length and severity of lockdown. Centralized controls relies on long and harsh lockdowns, and for these reasons, it has higher costs than its alternative, the citizens' involvement. It is interesting to note that governments are perfectly aware of what I'm saying. At the end of the 80s, Margaret Thatcher declared that there is no such thing as society. There are only individuals. More than 30 years later, another British Prime Minister, Boris Johnson, said one thing. I think the coronavirus crisis has already proved is that there really is such a thing as society. This view is shared by Angela Merkel, who stated that taking action collectively as a society is key. Macron said, I'm appealing to your sense of responsibility and solidarity. And Giuseppe Conte said that the responsible behavior of each one of us will be fundamentally important. Social capital is recognized as a very important component of the resilience to COVID. What is at stake is very important because we live in a world in which the stasis dream has come true. Thanks to digital technologies, we all can be monitored all the time. And this is a formidable temptation, not only for autocracies. It's a very easy way to deal with all crises, from epidemics to terrorism. We experienced limitations of freedom during the COVID crisis, freedom to meet, to move, to our privacy, and compulsory medical treatment. What is at stake is our freedom and privacy during epidemics, during crisis. The problem is that from this point of view, we have it's quite an entrance of trust. Well, I want to tell you that when people are informed of the facts and trust the information that they receive, they can do the right things even without a big brother watching them over them. A motivated, cohesive, and well-informed population can be more effective than an ignorant and controlled population because it can manage to control infection without resorting to the extremes of lockdown. Think of the common act of washing your hands, which saved millions of lives every year. It was only in the 19th century that this gesture became widespread, after it was discovered that it had a powerful antimicrobial effect. Before, even surgeons did not wash their hands. Today, billions of people wash their hands not because there's a soap police who monitor them, but because they know it is better to do so. The problem is that the trends of trust, which is so important, are really disquieting. Our index of trust has two very different components. One is trust in institutions, and one is trust in others, two very different things. Trust in institutions, look at the UK, mistrust in politics. In 1944, 35% of Brits thought that British politicians are out merely for themselves. This share had become 43% in 2014 and 63% in 2021. Look at the US. In the 50s, almost 80% of Americans trusted their government. Now they're 20%. In the 70s, more than 40% of Americans trusted the Congress. Now they're 10%. Trust in others, same trend, all declining. We have a problem there. How to deal with this problem? I've been studying a lot this, and well, policies are very different for the two components of our index. These are the policies for the relational component that dealing with trust in others. I've been speaking of these policies several times here in Luxembourg, so I'll be very short on this. Cities. Cities were created 5,000 years ago, and their goal was aggregation of people. And aggregation has always taken place in the common spaces, streets and square. And this lasted until cars arrived, because cars destroyed the quality of the common space and its capacity to generate the social fabric. We know exactly how to deal with this problem. If you go to see many Northern European cities, take, for example, Copenhagen or Amsterdam, what you find is that those cities are totally, they are in practice closed to private transportation, to cars. People move come with public transportation, a lot by bikes. And those cities are plenty of pedestrian areas, green spaces, where people go and meet. There are more kids playing in the streets in those cities than in Italian cities, which are invaded by traffic. Even though they have a very bad climate compared to the Mediterranean climate, but there are more people out there. So we know from urban studies how to create social capital, and we also know that that makes people happier in an urban environment. Just a hint on school. We go to school when we are 6, and in our first day of schooling, we have to sit 5 hours usually, which of course it's incompatible with the well-being of the 6-year-old kid. The first message that schooling sends to people is that you're not here to have a good time. You're here to perform. But perform is something, to have a good time is something very different. This is breaking news for a kid, which until that moment in his life has learned all the time, but through playing, which means that he's used to learn having a good time. Playing entails word and movement, which are the first things that the school prohibits. And then, so this is really breaking news. This is an existential message that we send to kids in their first day of schooling. And then we send them a relational message, which is competition with your peers, obedience with your superiors. There's no space for cooperation in schooling. Cooperation is the basis of social capital, and it is also our biological behavioral possibility, which is more pronounced. We are exceptional not for competition as animals, we are exceptional for cooperation, and there's no space for this in schooling. Well, we also know how to change this. There are examples of alternative schooling as Montessori schooling, which we know that perfectly work to creating people with more social capital, more sociable, more ethical, and even with better academic results. We know this also from many Northern European countries which adopted an approach to teaching, which is called participatory teaching, which includes many principles of Montessori schooling. And we know from studies that this kind of schooling creates more sociable people with more social capital and even, again, better academic results. There's no conflict between well-being and social capital on one side in schooling and academic results. So I go ahead on this because I've been speaking other times here of this. And on the other issue, how to strengthen trust in institutions. And the critical question here is, what is the root of mistrust in politics? Well, according to very influential political scientists, the answer is called post-democracy. Democracy was invented to make ordinary people participate to public decisions. Before democracy was invented, public decisions were in the hands of very closed elites. But, and it has worked. Especially for decades after the Second World War, democracy effectively worked to protect the interests of the majority of the population. And then it shifted progressively into what is called post-democracy, which means that political decisions has turned again in the hands of closed elites. This time, these are economic elites. In practice, it is the big business which has disproportionate influence on political decisions. Post-democracy, they say, preserves the forms of democracy: freedom of speech, public debate, free elections, but not the substance, which is that political decisions are affected by the interests of vast masses. Why closed elite control in practice political decisions? Well, there are several reasons. One, of course, is the increased influence of international financial capitals on governments. Another very important reason is money. Parties need, and parties and candidates need a lot of money because the expenditures for political campaigns have grown out of control in the West. It's an enormous and continuous growth. Parties and candidates need a lot of money to win elections. And who has the money? Not the ordinary people. Corporations have the money. That's a very simple explanation. Well, I'm going quick. Things are more complicated, but this is the substance. Evidence. Gilens and Page, two political scientists from Princeton, have been collecting data on the preferences of three groups of the American population across 30 years on more than almost 2,000 policy issues. The three population groups are ordinary people, representatives of economic interests, lobbyists in practice, and the 1%, the very rich people. And what they found is that anytime there's a conflict between what the ordinary people want and the 1% wants, the 1% wins. This situation has been worsening since the 80s. I mean, post-democracy is deepening. This is quantitative evidence. It's a very interesting paper. 40% of Parliament, European Parliament members, at the end of their mandate, work for companies that lobby the Parliament. What kind of independence can they have? Well, they're following good examples. Barroso, former head of the European Commission, works for Goldman Sachs. Tony Blair have worked for Petro Saudi, and Schroeder, as everybody now knows, has worked for Rosneft, Russian oil. So many people, my message, I'm very worried. Democracy is in danger and it's losing fascination all over the world, not only for the competition of and the successes of the Chinese autocracy, but also because people is losing, within democracies, are losing their trust in democracies. In Italy, 48% of the population wants what they call a strong man, a politician and that can decide without worrying for the parliament or for elections. And these data are similar in many European countries. So democracy is really in danger. And its alternative, the autocracy, is gaining fascination. And I think it's a very bad idea. We can change democracy. That's my basic message. The form of democracy, the current form of democracy is a heritage of the 20th century. It was conceived in a very different situation with big mass parties, which now do not exist anymore. And there are many possible reforms of democracy that may work. Many of them concern the financing of political parties, because that's a critical issue. In the US, there's an enormous debate on this issue. Well, I'm not going to enter into this point because it would take an entire seminar, but the message is democracy can be changed. It's just an historical heritage, and by innovating, we can make it work. But currently, it's not working. So mistrust of people in their political institution is perfectly justified in the light of what is very prominent political scientists say. Second issue, how to reduce chronic illnesses. Well, we know from epidemiological studies that happiness, and especially relationships, human relationships, play a dominant role in the health of individuals and populations. So the policies for relational goods, the relational component of social capital that I've been suggesting, would reduce illnesses, improving human relations, reduce morbidity. And this is especially true for the elderly. According to epidemiological studies, older adults who are socially isolated are compared to those who have reached social life, are at greater risk of, in practice, all the illnesses that plague the old age. Development and progression of cardiovascular diseases, dementia, memory loss, Alzheimer's disease, the guy in the picture is Alois Alzheimer, all cause mortality. More or less, comparing a socially isolated person with someone who has reached social life, the risk of the socially isolated person is double. It doubles the risk. So human relationships and policies for relationships are a kind of disease prevention. Policies for relational goods would diminish morbidity, and especially tackling elderly loneliness would reduce the number of chronically ill. There are very interesting policy examples, like especially the most advanced is Japan, in my opinion, which created those community saloons. Well, I have no time for this, maybe during the question and answers if you want more details. Even in UK, they are aware of the problem of loneliness, and they instituted the Minister for Loneliness. It's still unclear how effective it is. So So, first summary. To increase the resilience of Western societies to epidemic, we need to reduce economic inequality, develop relational policies to reduce chronic illnesses, and support social capital. And now the question becomes, how likely the social cultural changes induced by COVID-19 will drive our societies in the direction that I consider desirable? Well, let's start with the Great Resignation phenomenon. In 2021, over 47 million Americans voluntarily quit their jobs. Workers are massively searching for a more reasonable work-life balance. Well, why this happens? There are several hypotheses. For instance, according to the American economist Betsy Stevenson, the Great Resignation is driven by males with kids that during the lockdown tried the experience to spend a lot of time with their kids and then don't want to step back. Well, there are several explanations, however. The point is that in any case, downscaling, this is a downscaling of the growth priority, which is very important from the point of view that I'm saying, because the decline of social and environmental capital, which plays such an important role in the COVID crisis, depends on the weakness of policies to protect them. In turn, this is the consequence of two misconceptions, which still determine the social organization. The first is that the society does not exist, as Margaret Thatcher said, and that a livable future can be based solely on the pursuit of material self-interest. The second is that economic growth is the main way to increase the quality of life. These are two closely related ideas that have led to give priority to economic growth, neglecting social and environmental sustainability. Wow. Well, as students of happiness, we usually know that these two ideas are wrong. We know the importance of cooperation, sharing, generosity for happiness, and we know of the disappointing effect of economic growth on happiness. I'm not saying that it has no effect, but in the best of hypotheses, the effect is slight. COVID-19 is likely to spread this awareness to large sections of the population. However, when the priorities of people change and switch to the quality of life, as it is happening during the Great Resignation, well, this probably means that also societal priorities will change. This is the anticipation of a switch from the growth priority to a quality of life priority. And environmental and social resources are very important for quality of life. Well, I'll go very quick on this because I'm running out of time, and I also will move somehow. The whole history of the 20th century has been monopolized by the contraposition between markets and government. It has been a political, economic, and even military contraposition. I'm thinking of the Cold War. COVID-19 and the pendulum of the public opinion has swung on one side or another of these two extremes, depending on what we call critical junctures, which are facts that affect the society so deeply to change culture and social organization. For instance, the Great Depression in the 1930s convinced people that without state intervention, the market system would have produced mass unemployment. And so the public opinion was convinced by the state alternative. And then even the Second World War had this effect, because the reconstruction of a destroyed Europe after the Second World War was driven by the state. So the pendulum went on the side of the state. And then in the 80s, the difficulties of the socialist countries and then their collapse convinced people, discredited the state and brought the pendulum on the other side, markets. Well, climate change first, but COVID also will have this effect, are big collective crises. And during collective crisis, the center of the stage is occupied by collective action, not by individual action. That's a collective problem which can be solved only collectively. And this will bring the pendulum on the side of the state. We are already seeing that. The renewed consensus to public health care. Again, it's plenty of people that want now more state intervention in the economy. It's not that the world has been replenished of communists suddenly. It's the effect of the collective crisis of COVID-19. But it is unlikely that we will stop there. I mean, giving more value to state intervention, because there's a third pole between the state and the market, which is social capital. In this COVID crisis, we have seen that even the most competent and professional government would be impotent if people would not collaborate. We have seen in this crisis episodes of cooperation and even generosity. I already mentioned the mass testing in South Korea as an example of cooperation, but in the UK, the government asked for the National Healthcare Service asked for collaboration, asking for 250,000 of voluntary cooperators with the National Health Service, and the call had to be stopped after 5 days because they received 100,000 applications. They should have the time to process it. So in Italy, 300 medical doctors died while they were infecting, curing COVID sick people. So there's an enormous contribution by spontaneous cooperation, by people, acts of generosity. Well, this brings us away, very far away from the conventional representation of human beings, especially in economics. The homo economicus is not there. But even economists, well, the economics has always been called the dismal science because of its sad view of human beings. But happiness economics has shown that we are not only interested in material aspects, and especially the behavioral economics revolution have shown the importance of ethical motives in human behavior, generosity, and so there's no even. Well, I'll summarize like this point. Even the dismal science is beginning to smile. And when this happens, well, the economists are the most conservative in the landscape of social sciences. So if this happens, this is another reason to think that something very important is going to change. Many, many thanks for your attention.
Okay, thank you very much. My name is Alice Stoffel from the Ministry of Education in Luxembourg. And So I wanted to come back to what the representative of the statics said and what you said now. So the question was, how can we convince politicians to like subjective well-being? And so the first thing I wanted to say is that what the Ministry of Education, like particularly, I'm working as a psychologist on the, it's an administration called Center of Psychosocial Support, because we have psychologists in all the high schools in Luxembourg. So they're on site, they're not like in other European countries where they're off site, they are on site. And what the first thing we observed, and as psychologists, I would say, not as a ministry, because all this subjective well-being and how do you feel and all this more psychological variables, if you want to express it in statistical terms, people are not very interested, or it was not, I say, like the Germans say, salonfähig. So it's not a discourse that, at least in Luxembourg, it's not something you want to publicly talk about. And I think everybody, yeah, has the same effect that everything, so it's difficult to make socially acceptable, like a not well-being, like of yourself. So what we observed is that now it's something that you can talk about and youngsters want to talk about after the crisis. And so the psychologists, they're very happy because now we can do some policy about well-being. So it's bien-être des jeunes au lycée. So there has been a whole strategy that has been launched. So this is the first thing I wanted to share with you, that we observe, even though in Luxembourg you can observe that the well-being is not as growing, like the life satisfaction index, is not that growing, like there's a dissonance between the economic indicator and how people feel. So I hope that we can work on this. But what I wanted to say is actually what is interesting about your argument on trust. I mean, if you don't want to convince politicians to adopt something that's called subjective well-being, you might get their interest when you say that, yeah, you can work on trust. Because when you work on trust, if I correctly understood you, you can increase subjective well-being as well. And I think there's a European social survey working that worked on the effect of trust and subjective well-being. So basically the stuff, I mean, like we could work on take trust as an argument and indirectly influence subjective well-being
thank you.
Sure.
Thanks. Sorry, can I just ask the audience if they can keep the question short so we can take a little bit more question, and we also have the opportunity at the round table to discuss more in depth these questions, policy questions.
Thank you. I will be very brief. I will try to do that. Thank you for your remarkable presentation. You mentioned Western weakness about high inequality. I would say that it's a global world weakness. And if you try to correlate or understand trust and correlate trust, for instance, with inequality, we'll see close relations. If you try to correlate trust with progressive labor market institution, we will see also these relations. So the paradigm of inequality, it's, in my opinion, very important. And we have to think also not only on economic inequality, but the other consequences that this high economic inequality provokes, if could say, social inequalities. And the lack of cooperation is certainly one of them. About provocative questions. Struggle between capitalism and communism is that. Neoliberal struggle, the struggle between capitalism and communism is that. And neoliberalism will be a slow death. Populism will be a fast death. What's next? So you mentioned about the third pole, social capital. And I think a fourth pole is also very important that, of course, is connected with social capital, that is collective action. And you mentioned, yes, of course, but it's more than the individuals. So you need to have, in my opinion, politics needs to be prescient. And the increasing of democracy needs to have a more balanced power between citizens and politicians. So the solution will be to have this collective action. And in your opinion, do you think that it's, don't we need a new political program? Don't you think that, for instance, the work of Thomas Piketty, the work of Michael Sandel, of course, the work of Putnam will be this solid basis to increase and to build another political paradigm? Thank you.
Thank you. We have a third question there.
Thanks. So just a quick question, hopefully on picking up your point about increasing political participation. So I think a lot of our discourse in these kind of meetings is about reaching policymakers with evidence and reaching politicians rather than reaching citizens. And I dare say that this is technocracy rather than democracy. And just two quick examples of how this can backfire. So in the United States, there is a very big issue with trying to implement the kind of urban planning that you mentioned around walkability and these kind of things. And I think the evidence for those improving well-being is really strong. So no doubt on that, but the not in my backyard type communities, which have very strong social capital, block those through the political and democratic mechanisms that are available to them. So how can we convince those citizens that this is something that's going to be good for them? Another example is in the lead up to Brexit, which is one of the kind of high tide events for anti-elitism in recent years. Michael Gove said that people are sick of listening to experts from organizations with acronyms. And I think this is a really kind of powerful thing for people in this kind of space, like knowledge brokering with policymakers. How can we reach the citizens with their ideas? So I just wanted to ask you if you have any ideas on how we can get citizens involved in wellbeing policy and how we can make this a democratic movement rather than just a technocratic one. Thanks.
First, Stefano, congratulations on a quite fantastic talk. I imagine everybody in the room thinks so, really. You didn't mention the enormous growth of the global advertising industry. That's grown extraordinarily since the Second World War. And of course, it is designed to make us dissatisfied and designed to make us focus on materialism. So I wonder whether that might be part of your very interesting evidence list.
Yes, I have a question also, but I think it's related with just the question that made before. So you talk about policies for relational goods, about cities, schools, work, healthcare, but what about media? What do we need to change in media? I'm here. Yeah, media and advertisement, what do we need to change in there? Thank you.
Stefano, thank you for a wonderful presentation. And I see things from the other side because I come from a very poor country. And one, policy on trust. I often get the question from policymakers, how do you build trust? And my answer is transparency, number one. The next one is logic. Logic. People need to understand what you're saying and why. There must be reasons for what you're saying. During COVID, people were allowed to buy short sleeve t-shirts, but no long sleeve. Doesn't make sense. And then on inequality, I've got lots to say, so I'm going to keep it brief and I'll catch you later.
Take a last question.
Yes.
My name is Nunzia Nappo. Firstly, I want to thank you very much for your generous presentation. I'm wondering if you can say something more about Japan, how Japan is working on a relationship for the elderly well-being, and if you think that it could be a good model for our policymakers. Thank you.
Okay, I'm not sure I'll have the time to answer all the questions because many of them are require long answers and we're running out of time. So I'll start with the one which is quickest to answer, the role of advertising. It's an enormous, very important role that the advertisement industry has in promoting materialism, and those people with higher materialistic values has lower social capital, worse relationships, and are even unhappier, even unhealthier. So it's a very bad deal. The advertising industry do not sell products, sell lifestyles, identities. That's what they do sell. When I began to study happiness, and I was, which was a long time ago, I was first struck to discover that what I was discovering sounded very strange to my colleague economists. I'm an economist, but I was struck to discover that advertisers knew everything I was discovering. I've been insisting that non-material needs, social needs, are very important for people well-being. Advertisers perfectly know this. They never advertise products. They advertise feelings, positive feelings. They advertise happy people, success, love, social inclusion. They never advertise product. It's the rule number one of advertisers: never talk about the product. Associate the product to some positive emotion, and positive emotions are never connected to material aspects of life, are connected to social aspects of life. So advertising industry is one of the main responsible of the cultural negative twists that we have taken, should be strongly regulated, and many forms of advertising should be forbidden, as it is already done in many countries. For instance, in Sweden, advertisement targeting kids is forbidden. You cannot advertise toys. We should be exposed to a much lower amount of advertising. Advertising, especially some very dangerous forms of advertising, should be heavily taxed in order to reduce the amount of advertising we are exposed. Another very important point, how to convince, this is a point on which also Serge Allegrezza was dealing with, how to convince politicians of the importance of subjective well-being. Well, I have a strategy to do that, is to talk about America, because the advent of Trump was preceded, it surprised everyone except happiness scholars, because we knew that the white working class was accumulating impressive levels of low well-being, even despair, pessimism, across the decades. It began in the 90s, and this accumulation of extreme well-being, well, it led finally to political dramatic changes. So I think something similar happened in Italy, which is another country in which we had a very important nationalist electoral success. And also in Italy, this was preceded by the accumulation of a deep ill-being among the working class. The problem is always the working class. So I think that subjective well-being data has a very powerful predictive capacity of political changes. And from this point of view, I think we have to say something convincing to politicians. Well, I have to choose between the questions because I'll not be able to answer all of them. Consequences of economic inequality. The most important consequence is well-being inequality, because money buys some happiness. So the distribution of income affects the distribution of well-being. But in a paper with Francesco Saracino and Julia Slater, we show that social capital have a powerful moderating power on the impact of the income distribution on the well-being distribution. I mean that the countries where social capital is higher, in those countries, money buys less happiness. So the income distribution affects less the well-being distribution. Why? Well, because social capital is a common asset. It benefits all who access it. So it's, think of schooling, of public health care. It's the same thing. We all know that it has, that those things have a powerful redistributive impact because they are common goods. So the more we access to common goods, the less money buys happiness, because common goods are accessible to all persons. And social capital has a very similar effect to public schooling or public health care in smoothing well-being differences due to income differences. Well, I hope I've been clear. I should show you slides. And well, Japan, this is important. How do they do to improve the, how do they fight the loneliness of the elderly? First of all, that's a society which is perfectly aware that loneliness is a killer and drives people to sickness. How they are aware of this? Well, the government made a massive information campaign on this. And then they made a program to fight loneliness of the elderly. The program is based on government guidelines, but the government do not give any financing for this. It's financed by local authorities, which work in collaboration with NGOs and associations. Local authorities give the availability of the spaces. They call it community saloon. A bus picks up the elderly every morning, bring them to the community saloon and brings them back in the evening. In the community saloons, they have everything. They do courses of gym, courses. They keep alive their mind because there are all kinds of intellectual courses, cultural courses. They create relationships there. Those relationships are shared, are intergenerational relationships, because the sons of the elderly go to meet them to the elderly saloon, and the kids of the neighborhood are often, well, the elderly look after for the kids of the neighborhood. So they have several generations there, because generational segregation is a big problem for the elderly. And in this way, they have an impressive diminution of morbidity among the elderly. If you compare the elderly who do not go to the community saloon with those who go there, the morbidity is half for those who go to the community saloons. It's a very powerful way. And about your question, if this pattern can be replicated in Europe, my answer is yes, in those places where NGOs and associational activity is strong, because that's a very important part of the Japanese project.